Hello everyone, and welcome to our Chapter 4 continuation of our lecture. Before we get into Chapter 4 again, I wanted to let you know that you can go into our class on Blackboard, click on coursework, and go into Week 3, Chapters 4 and 5. And in here you're going to see I have the PowerPoints here for you, and also I created word lists for you to print out and write in the definitions. Keep in mind you're not turning these word lists into me. You're just going to use them on your own to help you study for your exams. Now with that said, let's go ahead and jump into Chapter 4. And I think we stopped right over here. Okay, so we're going to talk about some diagnostic radiology terms. We talked about a radiograph, well, the term graph at least, and radio is going to mean a radiant energy. So when you put the two together, you get radiograph, and then we also have the process of recording radiant energy, and that would be radiography. Now below that we have computed radiography, and that means that using a computer we can take image data and digitize it and immediately display it on our monitor or have it recorded on film. Below that we have radiopaque, and opaque always means it's something that light cannot penetrate. Light cannot shine through it. So radiopaque is going to mean that X-rays do not penetrate a structure, for example. So when that happens, the image will show up white, and I'll show you an image of that in just a little bit. And then we have radiotranslucent, and that means that the X-rays can penetrate whatever we're using an X-ray on. And these structures are going to appear different levels of gray. Continuing on, we have non-invasive and invasive. So whenever we use the term non-invasive, that means that the skin is not broken. So when we take an X-ray, that is non-invasive. Whereas invasive means that we are going to have some type of entry through a body cavity that's going to interrupt the normal body function, such as an incision within the body. So here is a X-ray image of someone who got a thumbtack stuck on their larynx, it looks like. So we can see that here in black is where we have air, or we have fatty tissue there, so it is turning up black or a dark gray. So in these regions would be a darker gray. And then we have our muscle tissue that is showing up as a light gray. For example, here would be like your esophagus in this light gray, and down in here. And then our bone is going to show up very light or white. So this is more of a radiopaque type of penetration. And lastly, if we have any metal like we do here with this thumbtack, it's going to show up as white. First we have echo or sono, and this means sound. So you may have heard of a sonography, and these are images of deep structures of our body, and it sends and receives high frequency sound waves that are going to be reflected back as echoes from the tissue's interface, and that can help to give us a sonogram, a record of this. Next we have electro, which means electricity. You guys have already seen this. And then we have fluoro, which means that emitting light. So if you have a fluoroscopy take place, it allows us to have a continuous type of imaging of motion of internal organs using a fluoroscope. So if you want to do something like see how food is moving through the digestive system, you can have the esophagus or the intestines recorded to see that moving through the internal organs. And then we have tomo, which means to cut. And lastly, we have ultra, that means excessive. Now I want you to stop this screencast and do exercises 6 and 7, and you will show this to me on Monday for credit. So you can go ahead and just hit pause. So we just got done talking about the combining form tomo, meaning to cut. Computed means we're using some type of computer device in order to get our images, and graphy we already know is the process of recording. So in picture A here, we're seeing that there's a patient going in for a CT scan, and they have to be in this supine position to go through the scanner, which is in the shape of a circle. And this helps to take images on all sides of the body. In B here, we see one of these images that have been taken, specifically of the brain. So our CT image here is going to show us several different slices of the anatomy of the body. And the other type of imaging that we're going to discuss is magnetic resonance imaging. This is also called an MRI, and it's used to require that a patient was in an enclosed area, completely within the magnet for this, but you can see that it's now more open. Before it was kind of like the way you saw in the CT scan where it is closed. So now we have open MRI machines that allow the body to stick out of the machine while the machine looks at certain areas on the patient. And then at picture B over here, you can see that we have an image of an MRI, and this is again another slice of anatomy, but we get a little bit of a more clear and crisp image. Next, let's talk about some treatment words. So we got analgesio, and this means sensitive to pain. Next, we have chemo, which means chemical. Pharmaco or pharmaceuti, we've mentioned before, means drugs or medicine. Plasto, we had plasty before, which meant a surgical repair, but this is now a combining form. So this is going to just mean repair. Plasto just means repair. And then we have therapeuto as a combining form and the suffix therapy, and both of these mean treatment. And lastly, we have toxo, which means poison or toxic.